I must ask you about the integrated care vision, the document brought up. Now, the Speaker of the House of Keys, Juan Watterson, raised the point that the document presented, which has been scrutinised by the Public Accounts Committee, is predominantly, and it is more than half of the document, is a direct replica of one produced 5 years ago in Wigan. Is that right, Minister?
Yes, it is. And in fact, I would suggest that the reason the Public Accounts Committee know that is because in the document we actually acknowledge Wigan. So I think that's the reason why.
You acknowledge special thanks to Wigan, but it then also says authored by Michaela Morris.
Yeah, because there is a lot of Manx sections within there. So, for instance, you say the majority of it, but that's the vision itself. And you've just hit the nail on the point, which I think I should clear up, because certain elements of the media, not Manx Radio, I don't think I've heard it from Manx Radio, have called it the Integrated Care Strategy. The document being referred to is not the strategy. The document referred to, as you rightly say, is a vision. So it's a high-level vision. The department looked at 6 or 7 different types of vision of integrated care to what was already out there that would best fit the island. And the one we felt best fitted the island was Wigan. So if you actually look at the document, so for instance, you've got the section of the third sector, which was written by the third sector over here. You've got the integrated care model at Ramsey that's unique to the island in that document. You've got the strategic plan for mental health and young people, that's unique. The public health data within it is Isle of Man public health data, including references to the Public Health Director's report. You've got the demographic data of the Isle of Man in there. All of that is actually unique. What isn't unique in the document is the overall vision, because we believe that's a vision that fits with the Isle of Man strategy for integrated care and what we need to deliver. And I think one other key point I want to make as well is there seems to be some confusion where again it's gone out and said that the case studies in the document are not unique to the Isle of Man. They've just been, people's names and so on have just been switched. What I need to point out is the bits that have been switched round are the examples, which in the Wigan one is just examples of the type of care you should expect. The case studies in the document, which are on pages 35 to 37, are unique Isle of Man case studies.
But it's billed as a Manx document tailor-made to the Isle of Man in terms of the vision, in terms of this plan we've got going forward. But it's just a reshaping of a document from the UK with a different populace. Wigan's got a different population, different kind of economic, social kind of criteria and in the population. So how is that something which applies here?
Well, firstly, with due respect, I don't think it is just a document that it's been billed as this unique Isle of Man document, and that it's been tailored. In fact, in my speech launching integrated care strategy, if I remember rightly, I actually, the vision document, I actually turned around and said that it was thanks to Wigan. And we had people from the UK over speaking at the integrated care launch. So I don't think there's been any attempts to conceal it. It's the first time it's been really raised and asked. But in relation to, you mentioned about Wigan's demographics, that's what I'm saying. It's a vision. The strategies below it, which are the projects that form off it to deliver integrated care, such as the Western Pilot we're currently doing, are uniquely Manx. So a vision doesn't just look at the demographics, it looks at the individual care being delivered in the community. Now, there were other ones that we looked at, so for instance, around the UK, that we didn't feel met with WAR requirements. So that's why we went particularly with the Wigan model. And one thing I do want to pick up on as well, I believe it was suggested there's not much proof of the Wigan strategy actually working. Well, in which case, people who are saying that haven't looked very far, because Wigan suffered one of the biggest budget cuts going across the UK. Yet since they brought this document in and they've started rolling the projects off from it, their looked after children numbers have been reducing year on year. Their adult social care made a surplus last year compared to most of the UK where there's a huge overspend. They've got one of the lowest levels of delayed transfer of care. They are the only outstanding CQC re-enablement service identified by CQC, and their internal staff satisfaction surveys are rising. And quite ironically, the timing of the PAC yesterday, Wigan is due this afternoon at 3:50 to speak to the King's Fund conference on the success of their integrated care project.
How much did this report or the vision cost to produce?
basically next to nothing because it was done in-house. That's one of the reasons as well why we decided, rather than going out for really expensive redevelopment of a vision absolutely unique to the island, we felt that if there's a vision out there and it's working, why shouldn't we do it in the Isle of Man? And again, I don't quite get it with the Public Accounts Committee, because they seem to be acting as if this is unique. If there's something out there, and other departments have done it over the years as well, and the Speaker himself has been a former minister, so he knows about strategies and legislation. If it's been embedded and it's working, and one of the reasons we took the Wigan one is because it's been in place 5 years, so we've got a record of it working, and we feel it fits the Isle of Man, why shouldn't we?
So is it common practice to effectively copy and paste documents from other jurisdictions, which we think might apply here?
Well, again, this focuses on copy and paste. The only bit that is copy and pasted is the overall vision bit. Everything else tied into it, such as the demographic data, the public health data, the strategies, are all Manx. So there's this absolute obsession being made on what is the overall vision. If this was some fundamental strategy document that laid out step by step how we were going to do integrated care in the Isle of Man, and it had just been picked up from Wigan, Birmingham, Edinburgh, I could understand the fuss. But when you're talking a high-level vision document, I don't quite see where the problem is. I think, actually, I would hope that what this encourages people to do is go online and actually read the document and actually see what it is.
But when you have over half the document word for word identical to one from across, and yes, it acknowledges with special thanks to Wigan, but it then says authored by Mrs. Michaela Morris, and it has all rights reserved, the normal kind of legal spiel, do not reproduce this without permission. It feels like plagiarism.
Well, in relation to the all rights reserved, that goes on all government publications, and at the end of the day, this vision document is a government publication, including, for instance, the graphics and everything else that's put in it. So ultimately, the ultimate author, which you have to have someone responsible for a document, is Michaela Morris, who is leading the integrated care strategy. But like I say, we acknowledge Wigan. There's been no attempt to hide the fact that our vision is in line with Wigan's. And in fact, like I say, if we've got a model that's already in place somewhere, it's working there, we believe it is suitable for the Isle of Man, we should be picking up that vision. And what matters at the end of the day isn't the high-level vision. What matters is the bit underneath it, which is the projects that flow off that vision to deliver integrated care on the ground. And quite rightly, they are all going to be Manx 100% projects. So again, I go back to the wet pilot in the West, which we're currently running, the integrated care pilot, which I believe is going very successfully at the moment. So that is 100% Manx. And like I say, the strategies that are mentioned within the vision document and referred to, such as, for instance, the young people strategy, the mental health strategy, they are all Manx strategies.
I think you can see why people would feel aggrieved, though, when you have case studies with a name in the Wigan document and a location where they live, and they are word for word taken. The name's changed, the places where these people are living are changed, and they're used as representative examples in the Manx, Manx document.
Hang on, I need to take issue with that, because what you're referring to there in the Wigan document are not case studies. They're the examples as to how integrated care works. So they're not actually real case studies.
So were they hypothetical?
They're
in the first place?
hypothetical examples. That's the one, and this is where the confusion's coming in. They're the ones that have had the names changed. The actual case studies in Wigan's document, I don't think off the top of my head there are any individual case studies, because it was brand new. They're coming out with the document 5 years ago. Our case studies are contained on pages 35 to 37 of the document, and they are uniquely Manx ones. The ones you're referring to, which are the examples, are pages 8 to 10.
But will you concede that what we have, rather than being a tailor-made vision for an island community bespoke to our needs, is actually the vision of a city, a town in the UK, which has been sculpted and reshaped to apply to us?
Yes, most definitely. And as I've said, I don't think there's anything wrong with that. I think if we've got something out there, elsewhere, and it's working, and we believe that it fits with us, why shouldn't we be introducing it? At the end of the day, would people rather that we went out and did everything absolutely bespoke? In fact, before I was an MHK, when I was a Douglas councillor, one of my biggest criticisms that I used to level at government was where they went out and reinvented the wheel, where they spent thousands upon thousands reinventing the wheel, if not tens of thousands in some cases, reinventing the wheel, when you could point to something and say, well, actually, that's already there and it's working. Be it, Canada, New Zealand, United Kingdom, wherever. Why aren't we looking to do something off that? And as I say, we've got to remember this is a vision document. So it's the high-level vision of how we believe integrated care should work. The practicalities of that, which are the projects and the strategies that flow off that, are 100% Manx, and quite rightly so. I think the bigger scandal would be if we had a tailor-made vision and then all the strategies were just taken from other places, because the strategies are the things on the ground, and they are the things that need to be tailored uniquely, not just to demographics, but to the individual small communities on the island.
I was at the hearing, and I witnessed Mr. Speaker Duan Watterson question the CEO and Deputy CEO, and they looked physically rattled, quite personally rattled by the line of questioning. You don't feel they have a reason to be, or had a reason to be?
I don't think so. I mean, I've done these hearings. I've got to actually say, I've been on both sides. I've sat on the Social Affairs Policy Review Committee, and as Minister, I've appeared before the various committees. And, it's always can be quite an intimidating experience. In relation to Miss Morris, it's the first time I believe she's ever appeared before a Tynwald hearing, and I think it's quite natural to be nervous. In terms of them being rattled, I wasn't there, so I can't say on that. But, I think, obviously, you don't get a list of questions beforehand, so you don't know what the committee's going to ask. So I think naturally pausing and thinking about what your answer will be, or in fact even saying you don't have that information to hand on certain occasions, is just quite natural. It's not, committee hearings can be quite intimidating places sometimes.
So this practice of adapting a vision or a strategy or document from elsewhere, perhaps in the British Isles, adapting it to fit to the Isle of Man to the extent where over half of it is basically a word-for-word replica. Is that common practice? Is that something that's done elsewhere as well?
Well, like I say, if it works, why not? But I think, again, you keep mentioning the over-the-half document, but you're not saying which half. The half that is actually word-for-word Wigan is the high-level vision of how integrated care actually works at the top level. The half you're not quoting, which is bespokely Manx, is first of all the strategies, so the young people's strategy, the mental health strategy, all the population data and demographic data in there is Manx, and also the public health report, and of course the example given of the Ramsey integrated care model. You've got the case studies as well, which are the actual case studies, not the examples ones, which are basically just examples of how integrated care should work for different demographics of people. So actually the half that is most important in the document, to my mind, is the half that is 100% unique to us.
So if the Isle of Man DHSC produced a document, wrote at the bottom the normal stuff, you cannot reproduce without permission of the author, and another jurisdiction in the UK wanted to borrow the document from us, the same principles would apply?
I would be quite happy with that. In fact, actually, to be honest, I would find it quite a unique compliment if anyone picked up an Isle of Man DHSC document and said, this is what we're wanting to do. And in fact, one of the things I would actually point out is we have had things similar like that happen where after the West Midlands reviews, having spoken to some of the people on the panel, they see practice over here that they said they were going to go back to their NHS trusts and start implementing those policies and procedures because they thought it was a good way to do. I think it'd be a great accolade for the Isle of Man if any of our policy and procedure documents were picked up and reproduced across the water. I think it's something we should hold up as a trophy.